Namaskar and welcome. You're watching this broadcast on DD India and I'm Sakal Bhatt. And first up, these are the top stories that we are tracking for you at this hour. Prime Minister Narendra Modi heads the meeting of Council of Ministers in wake of the surge in COVID-19 cases, terming the challenge as once-in-a-century crisis. Council reviews efforts made in the past 14 months and ways to tackle the challenge henceforth, once again stresses the importance of COVID-appropriate behaviour. In other news, COVID aid from neighbours to the major powers in the world continue to pour in from different parts of the globe to counter India's COVID-19 second wave. Two US Air Force C-5M Super Galaxy and C-17 Globemaster 3 arrive carrying oxygen cylinders and other supplies. Germany also dispatches supplies while Norway pledges aid worth $2.4 million. Vaccination campaign meanwhile continues to gain mammoth traction nationwide. Government provides more 16.33 crore vaccine doses to states and union territories free of cost. Cumulative inoculation crossed 15.22 crore. Total registrations on CoWIN portal for phase 3 vaccination reaches more than 2.45 crore and over 19 lakh tests done, while nearly 3 lakh recoveries reported in the last 24 hours. Government starts importing the vital drug remdesivir from the other countries to ease out the shortage of remdesivir in the country. The first consignment of 75,000 vials to reach India today. Government ramps up the production capacity of remdesivir in the country. The production capacity of the 7 licensed domestic manufacturers increased from 38 lakh vials per month to 1.03 crore vials per month. Augmenting oxygen supply continue on a war footing. Oxygen express operations expand to Haryana and Telangana after Maharashtra, UP, MP and Delhi. Indian Air Force flies in oxygen containers from Bangkok, Singapore and Dubai. Union Home Ministry issues orders for states to consider containment measures. Maharashtra government decides to extend lockdown restrictions till 15th of May. Lockdown in Goa till Monday morning. Jammu Kashmir administration announces 84-hour lockdown across 11 districts. And in West Bengal, exit polls predict a win for the BJP in Assam. Split verdict amidst pollsters for West Bengal. DMK will win Tamil Nadu, say pollsters, while BJP may lead in Puducherry, while left LDF government predicted in Kerala. Over in Israel, dozens of people killed in a stampede during a religious gathering for Bonfire Festival. Incident occurred when tens of thousands of Jews gathered at the tomb for annual commemoration. Prime Minister Benjamin Netanyahu has called the event a heavy disaster. And now for the top stories in detail. The Council of Ministers met today to discuss the situation arising out of the second wave of COVID in the country. Council of Ministers meeting noted that the present pandemic crisis is once-in-a-century crisis and has thrown a big challenge for the world. The meeting was held through video conferencing, was chaired by Honourable Prime Minister Narendra Modi. Prime Minister Modi said that all arms of the government are working unitedly and rapidly to deal with the situation. He also urged the ministers to stay in touch with people of their respective regions, help them and keep getting their feedback. Prime Minister stressed upon the need to ensure that issues at the local level are promptly identified and addressed. The Council of Ministers also stressed the importance of COVID-appropriate behaviour, wearing a mask, keeping a physical distance of 6 feet and washing hands frequently. The Council reiterated that the participation of society is a key aspect to accomplish the gigantic task ahead and expressed confidence that the country will rise to the occasion and defeat the virus. The efforts by the central government in coordination with the states towards building up infrastructure in the form of ramping up hospital beds, PSA oxygen facilities, etc., resolving issues in production shortage and transport of oxygen, tackling matters relating to availability of essential medicines were briefed. The measures being taken to further ramp up their supply and availability were also pointed out. The support measures to the vulnerable population in the form of provision of food grains and financial support to Jan Dhan account holders were also pointed out in the meeting. Meanwhile, Centre has once again stressed on scrupulously following COVID-appropriate behavior in the war against COVID-19 pandemic. In a detailed press conference, Health Ministry officials and experts said that states should follow new guidelines issued recently and work towards intensive action and local containment. Giving details of the efforts to ease the shortage of liquid medical oxygen, Joint Secretary in Union Health Ministry Love Agarwal recounted many steps that are being taken to augment the supply of oxygen.
DRDO की जो इंडिजिनस बनाई हुई एक टेक्नोलॉजी है, उसके तहत 500 नए एडिशनल पीएसए प्लांट सैंक्शन किए जा चुके हैं, जिनका कार्य भी शुरू किया जा रहा है। इसके साथ ही 551 पीएसए प्लांट्स हम यूनियन हेल्थ मिनिस्ट्री के द्वारा जो डिफरेंट पब्लिक हेल्थ फैसिलिटीज, पर्टिकुलरली जो कि हमारे डिस्ट्रिक्ट स्थाई पर हैं, वहां पर भी इन प्लांट्स को सैंक्शन करके उनका इंप्लीमेंटेशन का कार्य शुरू किया जा रहा है।
Well, the government is also trying to increase the number of cryogenic tankers, he added.
ऑक्सीजन का इंपोर्ट भी शुरू किया गया है। गवर्नमेंट की तरफ से 200 मैट्रिक टन ऑक्सीजन के प्लांट का ऑक्सीजन का ऑर्डर हमने सिंगापुर को प्लेस किया है, 1800 मैट्रिक टन का हमने आबू धाबी को प्लेस किया है और 1500 मैट्रिक टन अल्ट्रा प्योर गैसेस जो कि दूसरे देशों से इंपोर्ट करके हमें प्रोवाइड कराएगी, उनको प्लेस भी किया गया है। एक अति आवश्यक कार्य यह भी था कि जब हम ऑक्सीजन की सप्लाई को देश में सुनिश्चित करें, उसके साथ ही हम ऑक्सीजन टैंकर्स की संख्या को भी बढ़ाएं। आज जब हमारे देश में एग्जिस्टिंग 1224 ऑक्सीजन टैंकर्स हैं, जिनकी कैरिंग कैपेसिटी 16,732 मैट्रिक टन है, हम उसको बढ़ाकर 2000 तक करने के लिए कार्य कर रहे हैं, जिसके अंतर्गत हम 50% जो हमारे नाइट्रोजन और आर्गन टैंकर्स होते हैं, करीब 600 टैंकर, उनको ऑक्सीजन सप्लाई के लिए कन्वर्ट कर रहे हैं। साथ ही 138 क्रायोजेनिक टैंकर जो ऑक्सीजन के लिए इस्तेमाल होंगे, उनको भी हम इंपोर्ट कर रहे हैं।
In fact, Centre has also requested the states and local administrations to ensure that the attendants of the patients are kept informed about them and are provided some space in the premises itself.
आज जरूरी है कि जब पेशेंट के साथ साथ पेशेंट के अटेंडेंट एक हॉस्पिटल में जाते हैं तो वहां पर उनको उनके पेशेंट की स्थिति के बारे में बताया जाए, ताकि एक भय का वातावरण जो कुछ स्थानों पर हमने देखा क्रिएट हुआ, उसको कम किया जा सके। इसके लिए हमने स्टेट से यह भी रिक्वेस्ट की है कि जितने भी हॉस्पिटल हैं वहां पर अटेंडेंट के लिए एक डेडिकेटेड फैसिलिटी बनाई जाए बैठने के लिए। वहां पर उनको ये इंश्योर किया जाए कि वहां पर एक टेलीफोन लाइन हो जो कि नर्सिंग स्टेशन से कनेक्टेड हो, और कोशिश की जाए कि एक एफर्ट इंश्योर किया जाए कि एक सीनियर डॉक्टर दिन के एक नियमित समय पर वहां पर आकर उस हॉस्पिटल में जो पेशेंट एडमिट है उनकी स्थिति के बारे में अपने अटेंडेंट्स को वो बताएं, और जरूरत हो सके फीजिबल जितना हो डिपेंडिंग ऑन पेशेंट कंडीशन वह यह भी इंश्योर करें कि जितने भी अटेंडेंट हैं जो वहां हॉस्पिटल में आए वो अपने पेशेंट से बात भी कर सके, आइदर थ्रू ए ऑडियो कॉल और थ्रू ए वीडियो कॉल।
Union Health Ministry has issued revised guidelines for home isolation of mild and asymptomatic COVID-19 cases. Patients who are clinically assigned to be mild or asymptomatic are recommended for home isolation. Protocol to end home isolation has also been defined.
होम आइसोलेशन कब डिसकंटिन्यू करनी चाहिए, ये भी एक बहुत ज़रूरी चीज़ है समझना, और इसको कहते हैं व्हेन विल द पेशेंट स्टैंड डिस्चार्ज्ड एंड एंड होम आइसोलेशन। कब हम ये कह सकते हैं कि अब आप अपने कमरे से बाहर आ सकते हैं। इसके लिए जो हमारी गाइडलाइंस हैं वो ये कहती हैं कि एटलीस्ट 10 डेज हो जाने चाहिए, जिससे आप पहले सिम्टम से और फ्रॉम डेट ऑफ सैम्पलिंग ऑफ एसिम्टोमेटिक केस। तो यानी कि अगर आप आज टेस्ट पॉजिटिव हुए, आपको कोई लक्षण नहीं है, तो आपको एटलीस्ट 10 दिन होम आइसोलेशन करने की ज़रूरत है। अगर कोई लक्षण है तो एटलीस्ट 3 दिन ऐसे होने चाहिए 10 दिन में, लास्ट 3 डेज, जब आपको कोई फीवर नहीं हुआ और कोई और सिम्टम नहीं है। तो अगर आपको 6 या 7वें दिन के बाद बुखार नहीं हुआ और 10 दिन हो जाते हैं तो आप होम आइसोलेशन से बाहर आ सकते हैं।
Self-medication in case of COVID infection should not be done. Systemic steroids and remdesivir should only be used under medical supervision, the panel added.
सिस्टेमिक ओरल स्टेरॉइड्स हैं, वो हम यूजली कहते हैं कि आप माइल्ड डिजीज में अवॉइड करें, और इसलिए इंडिकेटेड नहीं है। यहाँ तक तो मैं ये कहूँगा कि इससे नुकसान ज़्यादा हो सकता है। तो ये समझना बहुत ज़रूरी है कि जो अगर हम सिस्टेमिक स्टीरॉइड जो हम कहते हैं, जो आजकल लोग बहुत ज़्यादा यूज़ कर रहे हैं, वो तभी लेना चाहिए जब आप अपने डॉक्टर से कंसल्ट करें, और नॉर्मली जब 7 दिन से ज़्यादा हो गए हों और बुखार हो रहा है या सैचुरेशन आपकी कम हो रही है, तब सिस्टेमिक स्टीरॉयड जो है वो डॉक्टर से संपर्क करके ही शुरू करना चाहिए। बहुत जल्दी शुरू करने में ज़्यादा नुकसान है। रेमडेसिविर जो है वो होम बेस के लिए, होम आइसोलेशन, माइल्ड और एसिम्प्टोमेटिक पेशेंट के लिए बिल्कुल उसका कोई फ़ायदा नहीं है, उससे नुकसान भी हो जाता है। इसलिए घर पे रेमडेसिविर बिल्कुल ना लें।
And now shifting focus to concerted strategies adopted by states to contain the onslaught of the second wave of pandemic. Now, some states are not launching phase 3 vaccination because they're still awaiting supplies, but at the same time assuring once vaccine supplies are dispatched, it will be done. Meanwhile, the inoculation exercise in phase 3 will resume. That's what the states are maintaining once they receive the supplies. While some states are awaiting delivery of these vaccines, the states are also ensuring strict adherence to the COVID protocols. Here's a detailed report.
Government of India has so far provided nearly 16.33 crore vaccine doses to states and UTs free of cost. More than 1 crore COVID-19 vaccine doses are still available with states, union territories to be administered. Nearly 20 lakh vaccine doses will be received in addition by the state, union territories within the next 3 days. On vaccination front, more than 2.45 crore beneficiaries have registered themselves on COVID digital platform for phase 3 of the vaccination. On the other hand, the cumulative number of COVID-19 vaccine doses administered in the country has crossed 15.22 crore.
और अब तक करीब 15 करोड़ के करीब डोजेस देश में फ्री जनवरी से देते हुए हम लोग आ रहे हैं। 50% जो देश की सप्लाईज हैं वह गवर्नमेंट ऑफ इंडिया द्वारा कंटिन्यूड फ्री वैक्सीनेशन थ्रू स्टेट एंड यूटीज चलेंगी, जिसमें कि हमारे इससे पहले साइंटिफिक दृष्टि से आइडेंटिफाई किए हुए प्रायोरिटी एज ग्रुप्स कवर किए जाएंगे, प्रायोरिटी हेल्थ वर्कर्स और फ्रंटलाइन वर्कर्स कवर किए जाएंगे। इसके साथ ही स्टेट गवर्नमेंट वह अपनी कवरेज और पॉपुलेशन और प्राइस को डिटरमिन करते हुए एक एडिशनैलिटी के रूप में गवर्नमेंट ऑफ इंडिया की तरफ से चल रहे इस प्रयत्न में वह भी एक भागीदारी के रूप में इसमें कंट्रीब्यूट कर सकती हैं, पार्टिसिपेट करेंगी। साथ ही प्राइवेट हॉस्पिटल्स भी, प्राइवेट संस्थान भी अगर वह 18 साल से अधिक लोगों को वैक्सीनेट करना चाहें तो वह भी एक ऑप्शन के रूप में प्रोवाइड किया गया है।
Vaccination drive is going in Poonch district. Till date, more than 63,000 people have been vaccinated there.
कोई शॉर्टेज नहीं है, हमारे कोई 65 सेंटर हैं जहां पे वैक्सीन हो रही है और जितनी वैक्सीन हमें ज़रूरत होती है उतनी मिल जाती है। वैक्सीन की शॉर्टेज नहीं आ रही है, उसमें हम बिल्कुल ही अपनी कोशिश कर रहे हैं कि हम 100% अचीवमेंट अपनी कर लें।
लोग आ रहे हैं वैक्सीन करवाने के लिए। स्टार्टिंग में हमारे यहाँ जैसे गवर्नमेंट की गाइडलाइंस थी, हेल्थ केयर वर्कर्स के लिए वैक्सीनेशन स्टार्ट हुई, देन फ्रंट लाइन वर्कर्स के लिए हुई, तो इसी तरह स्टेज बाय स्टेज वो फेसेस को बढ़ा रहे हैं। उसके बाद 45 to 60 का जो गैप ये एज ग्रुप था इसके लिए स्टार्ट हुई, और अब जो है नेक्स्ट स्ट्रेटेजी जो है वो है 18 से लेके 45 तक जितने भी हैं।
मेरी फर्स्ट डोज है, मैं लगवाने आई हूँ। मैं भी लेट हो गई हूँ लेकिन मैं लगवाने आई हूँ, तो मेरी अपील है सबसे कि डोज लगवाएं, अपना बचाव करें, अपने परिवार का बचाव करें और सबका बचाव करें।
Meanwhile, Madhya Pradesh government has said that vaccination under phase 3 for people from 18 to 44 years of age will not begin from 1st of May. State Chief Minister Shivraj Singh Chauhan, while addressing doctors, nurses and paramedical staff of the state through video conferencing, said that they had placed orders for vaccines but are not sure when they would get it.
1 तारीख से पहले 18 साल से ऊपर के नौजवानों को वैक्सीन लगाने का अभियान प्रारंभ होना था, लेकिन दोनों कंपनियों से संपर्क करने के बाद ये पता चला है कि 1 तारीख को वो हमें वैक्सीन के डोजेज दे नहीं पाएंगी। जैसे जैसे उत्पादन होगा और हमें वैक्सीन के डोजेज मिलेंगे, वैसे वैसे हम 18 साल से ऊपर के जो हमारे नौजवान हैं उनको निःशुल्क वैक्सीन लगाने का अभियान चलाएंगे।
Karnataka government has also announced that the third phase of COVID-19 vaccination for those in the age group of 18 to 44 years will not begin on 1st of May. Health and Medical Education Minister K. Sudhakar appealed to beneficiaries to refrain from visiting hospitals for vaccination from 1st of May.
We have made orders from the state government to Serum Institute at Pune for about more than 1 crore doses. But the official news is that they are still not prepared to give it to us from tomorrow as it was scheduled. So that is why we are requesting the people of Karnataka, especially those who are above 18 years up to 44 years, to refrain from going to the hospitals thinking that you may be vaccinated tomorrow. We will definitely intimate prior after the confirmation that we obtain from the Serum Institute.
Rajasthan Health Minister Dr. Raghu Sharma said the inoculation drive against COVID-19 to cover those between 18 and 45 years will not be starting from 1st of May in the state. The state minister said that Pune-based Serum Institute of India is providing 3 lakh doses of vaccine to Rajasthan. As a result, the state has decided to delay the commencement of vaccination drive for those above 18 years. However, the state government will prioritize vaccinations across worst affected cities based on availability.
अब इन 3 लाख वैक्सीन जो संभावित है आना, उसको हमने देखा है कि जो 9 शहर हैं जहां सबसे ज्यादा संक्रमण आज की तारीख में है, वहां इनको बांट के और वहां पहले 35 साल से 44 साल के एज ग्रुप के लोगों को वैक्सीनेट करें.
Maharashtra too is all set to begin phase 3 vaccinations in a phased manner. The current tranche of vaccines promised by SII and Bharat Biotech is not sufficient to service the third phase across the state.
पण एक नक्की आहे की 1 मेला
State government and Chief Minister Uddhav Thackeray intend to start vaccination for 18 to 45 age group from 1st May on limited centers. We will expand this as soon as we have enough vaccines.
एक तर तो महाराष्ट्र दिन आहे.
In Odisha, also vaccinations have been halted till Monday, awaiting delivery of stocks from vaccine manufacturers.
We have stopped vaccination in all the centers on Saturday and Sunday. So even if we get the vaccine today, we are not going to conduct tomorrow. So at best we can start from Monday if we get the vaccine today. After getting the vaccine only we will clarify whether it will be done and when it will be done.
The third vaccination drive in Assam is set to start soon with proper planning. Mission Director of National Health Mission in the state, Dr. Lakshmanan S., said that the state is getting required amount of vaccines from the Centre for the inoculation of above 45 years of age group. Vaccination for phase 3 will begin once more vaccines are received.
For 18 to 44 people, age group people, the registration process has already started. Now they will become eligible for vaccination. The locations where they can get will be communicated to them through the portal itself, and accordingly the vaccine delivery will also start. Further, this vaccine which is to be given to the 1844 as per the allocations made by Government of India, the state government is fully engaged in procurement, distribution and delivery of vaccines. We hope that in a very sooner day we will be able to start the 18 to 44 age.
Maharashtra government has decided to extend lockdown restrictions till 15th of May amid massive surge in COVID-19 cases. Section 144 of the CRPC remains in force across Maharashtra, with only emergency services personnel allowed to use local train services in Mumbai as well as other public transport in the rest of the state. The government has mandated that vegetable shops, grocery stores and milk outlets can remain open only between 7 a.m. and 11 a.m. In view of the increasing cases of corona infection in Uttar Pradesh, the state government has increased the 2-day curfew to 3 days as the corona curfew has helped in reducing the prevalence of the infection. An extended weekend curfew from Friday 8 p.m. to Tuesday 7 a.m. will be in place. Only essential services will continue uninterrupted. Industrial activities and vaccinations will also continue. Availability of remdesivir across districts is being ensured. It is available free of cost in government hospitals. COVID hospitals are being set up in Lucknow and Varanasi in collaboration with DRDO. UP CM Yogi Adityanath visited COVID hospital being prepared by DRDO at Awadh Shilpagram.
रात्रि से सोमवार मंगलवार प्रातः 7 बजे तक साप्ताहिक बंदी रहेगी. इस दौरान पूरे प्रदेश में ग्रामीण क्षेत्रों में, नगरीय क्षेत्रों में साफ सफाई, सैनिटाइजेशन का एग्रेसिवली कार्य किया जाएगा. उसके लिए पूरी टीमें बना दी गई हैं. सभी टीमें लगातार अनुश्रवण करती रहेंगी.
4-day lockdown began in Goa from Thursday night. Police personnel have been deployed for strict enforcement of lockdown. All essential services including grocery stores will be open during this period. State borders will be open. Restaurant kitchens are allowed to provide at-home delivery takeaways. Industrial services within campuses are permitted. In Jammu and Kashmir, the 84-hour lockdown in 11 districts began yesterday evening due to spike in number of COVID-19 cases. The Corona curfew will last till 7 a.m. Monday, that is May 3rd. The districts which have been placed under Corona curfew are Jammu, Kathua, Riyasi, Udhampur, Srinagar, Anantnag, Baramulla, Budgaon, Kulgaon, Pulwama and Gandarbal in Kashmir Valley. However, Lieutenant Governor Manoj Sinha has said that during the curfew period, essential services will be exempted from the purview of lockdown and inconvenience during the Corona curfew period. In Delhi, the COVID care center run by the Indo-Tibetan Border Police in South Delhi admitted about 400 patients since Monday. Facilities including medicines and food are being provided free of cost at these centers. The facility has a current capacity of 500 oxygen beds. Patients with worsening conditions are being referred to big hospitals. Bureau Report, DD India.
Well, vaccination for the 18 to 45 age group will not begin tomorrow in Goa. Government of Goa has placed an order for 5 lakh doses of COVID-19 vaccines for 18 to 45 years of age groups, but has not yet received adequate vaccine doses from the manufacturer. The vaccination will begin as and when the state receives the doses from the manufacturer. The state government will issue SOP for registration and vaccination for 18 to 45 age group. In a tweet message, Chief Minister Dr. Pramod Sawant requested people in this age group, that is 18 to 45, to not rush at vaccine centers on Saturday. And it is always said that learning and innovation go hand in hand. Researchers in Bhopal's IIT, Indian Institute of Science and Education Research, have proved it. They have actually developed a unique oxygen concentrator when the demand for the oxygen is rising in the country amid testing times of COVID-19 pandemic. This oxygen concentrator, named as Oxycon, is capable of providing 93 to 95% of the oxygen with a flow rate of 3 liters of oxygen per minute. This portable oxygen device costs just 20,000 rupees, can be easily used from villages to towns across the country.
ऑक्सीजन की जो डिमांड है, जो ज़रूरत है, वो पूरे देश में अचानक से बढ़ गया क्योंकि कोविड महामारी चारों तरफ फैल रहा है और इसी समस्या के समाधान के लिए हमने आईजार भोपाल ने टीम बना के ये ऑक्सीजन कॉन्सेंट्रेटर डेवलप किया जो
International Society for Krishna Consciousness is aiding the public during the COVID-19 pandemic. Particularly through free meals. As India is again witnessing a spike in coronavirus cases, ISKCON Delhi has come out with a plan to serve more vulnerable sections of the society. And during the COVID wave, earlier ISKCON Delhi served 5 lakh people every day. Shravan Kumar Seva under the Food for Life initiative serves food to elderly people, pregnant women and people affected by COVID-19, and the food is served at their doorsteps. Meals are served under the initiative are wholesome, nutritious and immunity boosting. ISKCON Delhi believes healthy, wholesome food with adequate nutrition daily reduces the health risk during the COVID-19 pandemic. Taking utmost care, ISKCON Delhi has also made separate teams for distribution so the risk of spreading the infection can be minimized. A short video we are going to show you on proning maneuver to increase oxygen level during home isolation in cases of COVID patients. You can have a look at the video. It's a very useful video which can help you and make you understand how it increases oxygen levels if you're unable to get a bed in hospital.
और इस तरह से झुकाना है कि आपकी पीठ ऐसे स्लोपिंग हो जाए. उसके बाद आपको गहरी सांस लेनी है और सांस छोड़ते वक्त खांसी करनी है. मैं एक बार आपको दिखाती हूँ कैसे करना है. ये मैनूवर बहुत फायदेमंद है. इससे आपके लंग्स में जो भी ग्लू जैसा पदार्थ जमा था वो बाहर निकल जाएगा. आपकी श्वास की नलियां साफ हो जाएंगी और आपका ऑक्सीजन लेवल बढ़ जाएगा. इस मैनूवर को हम आईसीयू या इंटेंसिव केयर यूनिट में भी यूज कर सकते हैं पेशेंट्स की जान बचाने के लिए. इस मैनूवर को घर पे जरूर करें.
Let's move on to some international news. Dozens of people have been killed in a stampede during a religious gathering for bonfire festival in northern Israel. Medics confirmed that dozens of people had been hurt at the Lag BaOmer event in northern Mount Meron, where tens of thousands of Jews were gathered at the tomb of a 2nd century sage for annual commemoration that includes all-night prayer and dance. Prime Minister Benjamin Netanyahu has called the event heavy disaster. The gathering had been held in defiance of health officials who had worries that crowding could pose a COVID-19 risk. Police say on Thursday that they had arrested 2 people for disrupting officers' efforts to keep order at the site. Meanwhile, External Affairs Minister Dr. S. Jaishankar has expressed sadness on the tragedy at Mount Meron during the celebrations of Lag BaOmer. In a tweet, he said, and I quote, "Deeply saddened at the tragedy in Israel at Mount Meron during the celebrations of Lag BaOmer. Extend my condolences and wish the injured a speedy recovery," unquote. And with that, it's time to wrap up this news broadcast with a polite reminder. Masking up is important, even if you're indoors, to keep yourself safe as well as your loved ones safe away from corona. Thank you so much for tuning in. Namaskar.